Good evening and glad to have you join us on another episode of the program Easy Access to Healthcare for All, a program that brings you news and happenings around the National Health Insurance Scheme. As enrollees visit the healthcare facilities, they are sometimes faced with the out-of-stock syndrome. They complain that they are given substandard drugs. The management of the NHIS towards addressing this challenge is pursuing an initiative that will give its enrollees medicine security when they visit hospitals. In this episode, we'll tell you more about this medicine supply initiative and how far it has come. We shall also meet a stakeholder in health insurance in our stakeholders segment coming up later on in the program. I am Aisha Muhammad Ahmed, your regular anchor. Easy access to healthcare continues after the short break. Join me then for the full package. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, CEOs of state social insurance agencies visit the NHIS. These and more stories coming up shortly.
The management of NHIS on Monday, 17th January 2022, played host to CEOs of state social health insurance agencies who paid a courtesy visit to the scheme. The visit was centered around various issues as it relates to health insurance under one roof.
Documentation.
Speaking at the event, Dr. Adeniyi Ogini, Executive Secretary, Osun State Health Insurance Agency, who is the chairman Forum of CEOs, appreciated the management of the scheme for the usual support. He also presented some challenges and urged the management of the scheme to look into them.
We have come to say we believe in your leadership. We believe in your staff. You have not acted as though you may not consider the sensitivities of the people that you lead. And I believe if you compare where we were in 2019 to where we were at the end of 2021, you will be pleased to see that social health insurance in Nigeria has moved forward. And we are looking forward to a more robust engagement in this year 2022.
From the National Health Insurance Scheme.
In his response, Professor N.M. Sambo, Executive Secretary NHIS, promised to look into the issues carefully.
I want to start by appreciating the chairman and the members of the state insurance agencies for deeming it fit to pay this courtesy call to the National Health Insurance Scheme today, 17th January 2022, which is the very beginning of the year. And I want to also thank the chairman and the members for well-articulated presentation in the sense that they have raised the fundamental issues that will further strengthen the NHIS and state health insurance agencies to be able to execute their mandates.
The meeting continued with deliberations, suggestions, and observations. In an interview after the meeting, the Executive Secretary of the NHIS, Professor Nasir Sambo, speaks on state health insurance agencies.
Health insurance at the level of state are coming up. So far, we have about 36 states and 30 cities that have had their health insurance on ground. Some of them have commenced enrollment with the Basic Healthcare Provision Fund. Some of them have reached to the level of service access. The vulnerable are currently enjoying services under the scheme. So all I can say is that they have commenced, and we will track them to get their level of performance and be able to report accordingly.
The chairman, Economic and Financial Crimes Commission, Abdulrashid Bawa, has called on the National Health Insurance Scheme to ensure that hospitals and other stakeholders who fail to treat patients who have been paid for under the health insurance scheme are sanctioned. He made this known during the presentation of the NHIS Digital Transformation Framework in Abuja. He emphasized the need to ensure security of data and servers for backups in various locations. He stressed that security of ICT infrastructure should never be allowed to suffer any kind of breach. Bawa also said that the ENHIS has the capacity to curtail fraud within the health insurance operations. He further advised that the ENHIS system should be integrated with the National Identity Management Commission's database for the purpose of synchronization to avoid the duplication of data collection efforts.
Welcome back. Availability and accessibility of medication during treatment is a major stage in healthcare provision. However, NHIS enrollees over time have had to contend with non-availability of prescribed drugs or the feeling that they are being given substandard drugs. Well, the NHIS is making moves to ensure that drugs dispensing under the scheme is seamless. Let's find out how it is going about it in our next segment, Issues Around the NHIS. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
It is the objective of the National Health Insurance Scheme to see that every Nigerian enjoys easy access to healthcare whenever the need arises. However, access to healthcare often requires that medication be prescribed and dispensed. It is at this stage that enrollees under the scheme face a challenge.
You know, over time, most of the enrollees in the National Health Insurance are complaining that the drugs they are getting under the National Health Insurance Scheme is fake or are fake. And the drugs are not actually fake drugs. They are generic drugs. And because of the consumer level of consumer education, if drug is not branded and is not expensive, they will always assume it is a fake drug. But in medical parlance, the generic drug has the same efficacy and potency with non-generic drug.
In a bid to create medicine security for enrollees, the scheme under the management of Professor M. Sambo, in line with his reforms, introduced a medicine supply initiative. This initiative will address the challenges of availability and accessibility, as well as create medicine security.
These numerous complaints that we receive at the level of NHIS, we now decided to constitute a committee to look into the issue and see how this thing can be addressed. So the idea of branding drug with NHIS inscription, just akin to what has happened during PTF, under the leadership of the current president, where drugs were produced by Nigerian companies with inscription of PTF, and wherever you go, you see those drugs, and you are very assured that these drugs are genuine drugs, are not drugs that has just come into the market through the back door. So we are we are borrowing that concept within the National Health Insurance Scheme in collaboration with all the stakeholders to ensure that we revisited that initiative through NHIS Medicine Initiative.
The challenges are various. People are going to the hospitals, they are not getting the drugs. If they get the drugs, they have the perception that the drugs are either fake or substandard. And so the cost of the drug is another issue. There is skyrocketing cost of drugs prices of drug, and this is mainly because of the inflationary trend in the country.
This initiative targets 3 core areas, which include branding of drugs, cost sharing, as well as innovative financing. Dr. Agada explains further.
The drugs, there are 3 core components of this particular initiative. The first one is branding of drugs. So we are going to brand drugs. So you have drugs produced by manufacturers, and then the manufacturer logo is there, NHIS logo is also there to show that this is a drug from this manufacturer. It has been ascertained by NAFDAC, and NHIS is aware of these drugs. So the second component of the initiative is what we call cost sharing. So we are negotiating with the pharma companies directly, and what that amounts to is that we'll be able to negotiate prices with them. A key example is oncology drugs for cancer. They are quite expensive, especially the newer, more effective ones are very expensive. We are talking of millions of naira. NHIS is negotiating with the drug manufacturing companies to bear part of the cost, as you will call it corporate social responsibility. It will be like giving back to the society. And they are saying, okay, many of the companies are saying we can even do 50% of the cost. And if that happens, our people, enrollees of NHIS and other Nigerians will be able to benefit. The third one is what we call innovative financing. Innovative financing would involve setting up funds that we will use to also treat, either to look at high volume drugs or medicines, or high cost medicines. So you have a situation where you have a fund for cancer, you have a fund for organ transplant. From that fund, you can finance some of those things, so you don't go into enrollees contribution and take so much from me to go and do organ transplant. That is to ensure sustainability of the scheme.
Dr. Agada gives more information on the commencement of the initiative and the respective stakeholders involved in it.
The good news is that we have received a ministerial approval. We needed that ministerial approval to move forward. We have received that. So very soon we are going to put up adverts. We are collecting data from some of the pilot states. Once we have those data, we are going to go into the field and then do adverts in some dailies for companies, pharmaceutical companies that are interested to come on board. And then there's something we call drug management organizations, which are vehicles that we intend to use for them to also apply and come on board.
Discussions towards actualizing the Medicine Supply Initiative have advanced. In the last quarter of 2021, the Medicine Supply Implementation Committee of the NHIS met with the drug management agencies DMAs towards finalizing some of the initial agreements. The importance of the NHIS Medicine Supply Initiative cannot be overemphasized, as it will help towards the attainment of universal health coverage.
Medicine Supply Initiative, I think this will really address that issue, because then we'll ensure that the drugs we're giving our clients are of good quality. That will improve the quality of care that we are giving, and that will make healthcare providers and the facilities to ensure that they stock the drugs that are of good quality.
In fact, many of us who are operators of health insurance are often so embarrassed when our enrollees go to facilities and they say that, oh, they supply the drugs they have is just paracetamol and things, and the real drugs, like the branded drugs, they don't have, so health insurance drugs are inferior drugs and things like that. It has actually affected people coming on board this thing. But now, with this initiative, we're partnering with manufacturing companies that will be branding drugs for NHIS. So everywhere you go to under the scheme in the health insurance ecosystem in Nigeria, you are going to be having branded drugs. These branded drugs will be of good quality, and then enrollees will no longer be saying that these are inferior drugs and things.
This laudable initiative will give enrollees medicine security and satisfaction when they visit the hospital. Dr. Agada outlines 2 approaches in which it can be achieved.
So one of the things we want to do is to stop this out-of-stock syndrome. And if we're able to do what we want to do correctly, what you are going to have in the future is that the needs of the hospitals are going to be collated and then passed on to the manufacturers to manufacture those drugs. So, and we are also using another initiative, which is the community pharmacies. How if people go to hospitals, they should be able to get prescriptions to go to pharmacies to collect drugs. So we are hoping that if we use this 2-pronged approach, that in the nearest future, issues of out of stock should be a thing of the past.
Paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
Easy access to healthcare for all every Saturday at 8 p.m. on the NTA network service.
Welcome back from that break. Easy access to healthcare continues in our stakeholders segment. Today in this segment, we will be discussing with Dr. Ahmed Damfulani, CEO FCT Health Insurance Scheme. He is also the Deputy Chairman Forum of CEOs of State Social Health Insurance Agencies. He is an ardent supporter of health insurance under one roof. He gives a brief history on the emergence of FCT Health Insurance Scheme.
The FCT Health Insurance Scheme is one of the state social health insurance schemes. It was established almost 15 years ago. Actually, it's one of the first state social health insurance schemes that was established, almost immediately after the National Council on Health gives the go-ahead that states should establish their agency so as to support the inadequate enrollment that's coming out of the National Health Insurance Scheme.
Damfulani said the operation of the FCT Health Insurance Scheme is in sync and adapted from that of the National Health Insurance Scheme.
When the Health Insurance Scheme in FCT was established, it follows the pattern of the National Health Insurance Scheme, the NHIS. And so basically everything that was done then was, adapted for FCT Health Insurance. However, many of those things have been gradually, adapted to suit the FCT.
Enrollment into health insurance generally is a bit of a trouble. Dr. Damfulani gives an update on steps taken to get residents of the FCT enrolled.
To convince people who are healthy, who are not sick, to come and buy health insurance is an equivalent task. However, we have done a lot of activities, efforts to ensure that people are convinced to, join the FCT Health Insurance Scheme. The formal sector, which included the FCT staff and the area council staff, because that's a lower hanging fruit, and it just requires conviction of some of the staff to come onto the scheme. So we have done that. So as I speak with you now, we have done more than 90% of the formal sector in FCT. Now, for the informal sector, or the other group that is not for people who are in, business arena, the first thing we did is to, engage the communities. And in doing so, you will have to go through the community leaders. So we have, engaged all the community leaders, especially the traditional rulers in FCT. We are also association with religious leader, both the Christian and the Muslim.
How is the coverage in the FCT? Dr. Damfulani speaks further.
We are doing good, but it's not where we want to be. Like I said, presently I told you in the formal sector, we're able to cover all the FCT staff. Once you are registered as a staff of FCT, you are covered, and also the area council. Then also the informal sector, especially those groups that are not in government activities, a lot of them also has been covered. And I told you we have partnership with the Okada rider, the market women. Also, in the poor and vulnerable areas where pregnant women and children under 5, the people with handicap, and the other people who are very poor, especially those that are on the National Social Register, who are already assessed and found to be a little bit poor and they cannot pay for the service. Quite a number of them have been covered. But like I said, it's a journey that has just begun, and we still have a long distance to go.
Every organization has its peculiar challenges. Dr. Damfulani speaks on challenges facing the FCT scheme.
The constant future of any challenge of any organization is funding, but we are getting around that. But the bigger challenge to me is the fact that there is still a lot of poor understanding, ignorance about the advantages of health insurance. A lot of people still find it very difficult to see reason why they should pay for it when they are not sick. So those are the major challenges that we're having right now.
In conclusion, Dr. Damfulani speaks highly of Professor N.M. Sambo, his reforms and good works.
Professor Nasiru is a very wonderful person to work with. He's a team player. He has a listening ear to issues, and he will never say no to your request, especially when it has some reasonability in it. He's a man that is focused, and he knows what he wants, and he's a steady and astute worker, and he's somebody that if he gives you his word, that's where you're going to meet him. So far, so good. He's bringing a lot of changes to the health insurance landscape in Nigeria.
Paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
Easy access to healthcare for all every Saturday at 8 p.m. on the NTA network service.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: if I am single, can my children benefit from my contributions?
Definitely. Your children, once they are biological, it doesn't matter. I mean, we don't decide whether you are married or single. The basis is that you are actually a contributor under the health insurance system, and we can verify that the children that you are registering are your biological children, or whether biological or adopted, as long as we have proof that they are your children.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
With these, we come to the end of the program, Easy Access to Healthcare for All. Please make it a date with us again, same time and on this same station for another interesting episode as we continue to bring you more stories around the NHIS as it marches towards universal health coverage for all Nigerians. Thanks for watching.
Easy access to quality healthcare for all.